I am Dr. Caitlin Kothe. I am a physical therapist and clinical director here at Tennessee Sports Medicine Group. I am a certified strength and conditioning coach, as well as I have a master's degree in exercise physiology. I also teach over at South College and in their Doctor of Physical Therapy program. And I teach in some of the entry-level courses. We just got finished talking about how prevalent low back pain is. So back pain has been shown over the course of a 3-month period, up to 25% of all Americans will experience an episode of low back pain. And chronic low back pain has been found in up to 31% of the US population. And to me, there's a lot of simple things that we can do to help reduce low back pain. So for example, one of the best things shown across the research for low back pain is movement. So it's important to get up and get moving. During the pandemic, a lot of people had to be in their homes sitting a lot more at their desks than they're used to. So I encourage you to get up, get moving, take a walk outside, walk around your house if you need to. Another option to do at home, if you need to do a lot of sitting, is to get yourself one of these balls. So by sitting on a ball like this, not for your whole day, but for parts of your day, you can move yourself around and keep your spine moving while you're sitting at your desk. So I'd highly recommend it if you're finding yourself doing a lot more sitting. Something else that you can do is just try to get a little length through your spine. There's a little trick to do that at your desk. So if you sit in your desk, place your hands on the armrests, push yourself up, but then let your bottom fall towards the chair. You've basically just done some traction on your spine, letting some space and some air get into all those areas that are getting pushed down as you're sitting at your desk. Now, if you find that those things feel good, but it's not getting rid of your pain, maybe it's time to consider getting in with a physical therapist or a doctor. So the recommendations from the APTA, the American College of Sports Medicine, and the American Physical Therapy Association is to try PT first. So we've shown that surgery is not recommended, and opioids are definitely not recommended. So I'd highly recommend getting in to see your favorite physical therapist. So here at Tennessee Sports Medicine Group, we have a variety of interventions that we can do to help you get rid of your back pain. The most important thing is that we need to focus on function. So first we're going to ask you the things that you want to be able to get back to doing. Then once we know that, we can perform a detailed movement assessment to see if your pain comes on with certain movements like bending forward or bending backward or twisting. Once we know those things, we can identify maybe the joints, the muscles, or the variety of structures in your body that might be involved. From there, here we use a lot of hands-on techniques coupled with movement-based therapies. Some of the hands-on techniques that we use here are mobilizations and manipulations of the spine or joints. We use augmented soft tissue release. We also have Western dry needling techniques that we'll use, and a variety of other instrument-assisted techniques to get into the tissues themselves. After we've warmed up the tissues with those techniques, we'll bring you back to our big gym where we can do a variety of different exercises targeting specific muscle groups. If we need some additional strengthening of those groups, we can do blood flow restriction training, which has been shown to increase the strength of specific muscle groups. Then we can also do a variety of functional-based activities. So we can look at golf swings, we can look at how your running pattern is, really anything that you do and get a more detailed look. From there, we would also designate a few exercises for you to do at home, as well as change some of your functional activities to help reduce your pain. If we still haven't targeted down onto the thing that we need, here on site we do actually have an x-ray machine that we can get some detailed imaging of what's going on, and diagnostic ultrasound, so we can look at the soft tissues themselves. Hopefully we wouldn't need that for you, but we've got it all here to help you feel better. In very rare circumstances, we may need to recommend that you go see a doctor for some additional imaging or intervention. We'd handle that with you personally. We'd love to see you here at Tennessee Sports Medicine Group if you need us. Thanks so much for spending some time.